The first question patients are going to ask you is, what is going to be the course of my disease? Of course, they have read about the disease and they know there are different forms. Some are more aggressive than others. So that's the first question. And we have some clues, as I mentioned, from the MRI and the history that tell us if the disease is probably going to be aggressive or not. So I would have this discussion with them. The next question they ask is, what is the best drug for me? And that's where personalized medicine comes in. We don't have a specific biomarker now that would tell me I'm going to use drug A for patient X and drug B for patient Y. That's really a hot area of research that is the focus of personalized medicine. I want them to know that despite the fact that this is a chronic and often progressive disease, that there are several effective drugs for it, and that we can either delay the occurrence of the subsequent attacks or halt the progression of the disease. I think there is a role for primary care physicians in medicine in general. Initially, it is important that the right diagnosis is made because there are conditions that can mimic multiple sclerosis, and that requires a subspecialist, a neurologist, subspecialized and trained in MS to make the correct diagnosis. Then treatment is complicated. So most therapies now are initiated at MS centers. But then once the patient is stable, I think it becomes important to coordinate care. I think the role of the PCP, the primary care physician, becomes even more important in the progressive stages of the disease, where supportive therapy and symptomatic therapy becomes critical to improve quality of life, because there are complications associated with the disease, bladder infections, other things that would be important for primary care physician to coordinate the care for those patients among several specialties. Research in MS is moving fast. Both clinical research, basic research, and typically those meetings are update on the progress made in the 6 months or a year between meetings. And clearly it is not a repetition from one meeting to another. There is always new stuff coming out, particularly in the area of progressive disease now, and new therapies in general. Definitely, I must say that I'm now past president of ACTRIMS, but definitely one of our goals is always to update the attendees on advances in understanding MS and newer therapies.